Well, Kim Kardashian and Jennifer Aniston are endorsing a fishy new treatment. Can salmon DNA really be the secret to getting that glass skin everybody's talking about on social media? This morning we were talking about regenerative medicine. It's a trend, and the treatments that can make your skin look smoother, firmer, and younger. And who doesn't want that?
Exactly. Dr. Sandra Lee, also known as Dr. Pimple Popper, back to break it all down for us. And I love what we were talking about is that it doesn't have to be expensive. And sometimes expensive doesn't mean that it's the best.
Yeah. Yes, but there are all these new buzzwords right now. Regenerative medicine, biostimulators, skin boosters, and it gets really confusing because there's so many. Yes, it does. It all sounds good.
Right.
I want to remind you before all these other things we're going to talk about, the tried and true. The difference is retinol, tretinoin, and those sort of products, they've been around for generations. We know they do something.
They work.
So that's really a basis which everyone should really think about. And then you can add some of these things. You know, these things are wonderful. I love that they're trying to find out new ways of doing things, but you know, are these going to be here in 5 years, in 10 years? I don't know. I don't know for sure. Maybe some of them will, maybe none of them will. We don't know.
So we've said this is the tried and true.
Yeah, tried and true.
Retinol and tretinoin.
This is glass skin.
This is what I've been seeing all over social media because it's like so clear and shiny, and I love it. So this is what will get it for us?
Well, this is salmon DNA. That's what it is. It is the DNA from salmon, and they actually
salmon sperm?
There's a product called Regenerative that they actually inject it underneath the skin, and that is done in Korea. So, like, I think Kim Kardashian went to Korea on her show to get injection, and you see it all over the internet. It is not allowed.
All right, we hate to interrupt you, Dr. Lee, but unfortunately, we have been waiting for a presser.
I want to get back now to Dr. Sandra Lee, also known as Dr. Pimple Popper. Let's pick back up with what we had going on here.
PDRN. This is PDRN. It's injectable in other countries, but in the United States, Medicube has products that has this salmon skin DNA topically. These are wonderful products to use if you want to do that salmon skin, that glass skin thing. This is more expensive, yes. It's available on TikTok and online.
Oh,
this is what all the girls are talking about on Instagram.
These are all pricey. These are exosomes. This is actually a very hot thing. Hot thing. A lot of dermatologists talk about. It's like these little vesicles that really message other cells and tell each other like to regenerate and to improve. So this is also not available by injection, but we have topical products.
Great.
This may look like it's injection. This is PDGF. It's platelet-derived growth factor. You've heard of PRP.
I have,
PRP. This is like a super potent form of PRP.
Really?
You don't have to draw your blood and spin it down. This is growth factor in itself.
Really?
So you can actually put it on your face after laser resurfacing or after like a skin pen, that sort of thing, to really help the wound healing much quicker.
But this sounds very expensive.
This is more expensive, and this is done at the doctor's office usually.
Yes.
And
what is this? My friends have been doing this.
Yes. This is nicotinamide adenine dinucleotide. This is an energizer. It converts your food to energy. So this naturally declines as we age. So people are trying to replace it.
Okay, so my friend is using this. Does it actually work?
I think it can really give people some energy, but
you
know,
have to use a needle.
sacrifice. Yes, there's issues with this. You have to go see somebody for this to be done. So there's positive and negatives. If you're going to try to take it by a pill, it's really not going to do its job.
So if you're going to do it, you have to do it this way.
You do need to do it that way.
And what is it going to do? Are you going to look different?
It's going to energize you. It's going to give you more energy. It's going to, you know, it's just going to rejuvenate you. It's going to make you feel better. It's going to. Yes, that's what it's supposed to do.
Gotcha.
So.
Okay, I think I'm sticking to
just
the regular.
This has been around for so long, and that's what people have to remember. You know, sometimes there's new things that are great, and some of them might really continue, but you just never know.
And what's the price difference between a
I think these are usually less expensive. They've been around for a while.
Yeah, so there's many different versions.
And you can find your own brand.
And many of them are used by, for acne, so some of them can be covered by insurance.
I want to dive into the salmon skin, though. I like an experiment.
Yes. Topicals are safe, too.
Were you the one who was doing snails and stuff,
Sure was. That snail mucin. Dr. Lee approves.
Yes. We appreciate you coming, and thank you for letting us come back to you.
Sorry for the interruption.
There's just a little breaking news happening.
Yes.
Well, we appreciate that.
Thank you, Dr. Lee. We love skincare. We also